Hi everyone, welcome back to my YouTube channel. This is Dr. Nakumufaya or just Dr. Mfaya. In today's video, I want to talk about sickle cell disease. Before we begin the video, I would like to say thank you so much to all the subscribers that have subscribed to my YouTube channel. We are now at over 50 and I really thank all of you for the support and for subscribing. Please share the videos and tell your friends to subscribe as well. So in today's video, I will be talking about sickle cell disease. Sickle cell disease is a very common condition, mostly in Africa, in sub-Saharan Africa, and in some Asian countries. So sickle cell is a very common disease, especially among Black people. Previously, the mortality rate for sickle cell patients was very high, but currently, with improved diagnosis and improved management of patients with sickle cell, patients are able to live even up to 50 years and above. So what is sickle cell in the first place? Sickle cell is a disorder of is a condition characterized by a sickling of the blood cells. So the blood cells that are the red blood cells that are supposed to be round in shape, they become crescent or moon shaped, and so they are not able to deliver enough oxygen to the cells, and they can cause organ damage and cell damage in some cases. So patients with sickle cell vary in terms of symptoms. Others will present with pain. Others would have anemia if the blood cells are destroyed at a very fast rate because of their shape and because of the abnormal shape. People may present with yellowing of the eyes, enlargement of the spleen, pain in the joints, pain in the chest, pain in the abdomen. So all these are different symptoms that people with sickle cell would present, and it just depends on which organ has been affected at that particular time. And so what really happens is that because the cells and the blood cells are not in the correct shape, they're abnormally shaped, so they will not be able to pass through very tiny vessels easily. And so what will happen is they will go and block those small blood vessels and cause cause that part of the body not to receive oxygen, and so it will become very painful. They will need to be given pain medication at the hospital. So if you have sickle cell and you experience such symptoms, do not delay to go to the hospital when you start feeling pain, because it will save you. The other thing that patients with sickle cell would present with is anemia. This is because the blood cells are being destroyed. Because of their shape, they easily get broken down by the body, and so the patient who have anemia, they will not have enough blood cells. At the same time, the blood cells that they have are not carrying out their intended purpose very well, because they are not carrying enough oxygen. So patients will have anemia, and so they will need blood transfusions every now and again because of the anemia, and also just to replace those crescent cells with normal blood cells. So they will have a series of blood transfusions. And the other thing that sickle cell patients have to really take care of is to avoid getting infections. They are more susceptible. Sickle cell patients are susceptible to having chest infections, lung infections. So they need to take care of themselves, of their selves, and avoid getting infection from other people in the environment and whatnot. So they need to really take care of themselves, and if they're able to get some vaccines to prevent getting infections, whether it's an influenza vaccine or COVID vaccine, then they should be able to do it, because it will really save their lives, and they will not have to worry so much about getting sick. So yeah, those are some of the symptoms that patients with sickle cell disease would have. And sickle cell is an inherited disorder. So people who have sickle cell have inherited it from their parents. And if your parents are carriers and they are not sickle, they do not have the disease, the sickle cell disease, and both of them are carriers, there's the likelihood that maybe two of their children will have a sickle cell, or one of their children will have sickle cell and maybe the others will be carriers. That is how a person inherits the disease from their parents. If their parents are both have the sickle cell trait, or if the parents both have sickle cell, or if one of your parents has sickle cell and the other one has is a carrier. So there's a likelihood that two of the children or one will have the disease. It can also help to know your partner's sickling test before you get married. If you know that maybe you have sickle cell and you do not want to pass it on to your children, you could try to check with your partner if they have sickle cell, and if they don't, then it means all your children will not have the disease of sickle cell, but they will be carriers of the condition. And if your partner has is a carrier, has a trait of sickle cell and is a carrier, it means there's a likelihood that you will have a child with sickle cell, and maybe the others will be carriers, and maybe the others will be carriers and one of them will have sickle cell. So that's one thing that you can do if you are really concerned about not passing it on to your children. Then the other thing I would like to say is sickle cell patients really need a lot of support and care and love, and so we should not stigmatize against them. We should really support them and be there for them. Sickle cell patients will also need a lot of hydration. They need to take in a lot of fluids so that they cannot become dehydrated, because dehydration can lead to other side effects or other complications. I really do hope that this video has been very helpful. If you like to know more about sickle cell and you have any other questions, you can let me know. Reach out to me and I will be able to answer your questions. This was a very quick video and very short on sickle cell. I really do hope you have learned something, and don't forget to like the video, share with your friends, and subscribe to the channel. I'll see you in my next video. For now, it's bye.